Hello. In this video we're going to take a look at the brains of transgender people with the aim to help us understand and improve acceptance for trans people. Using neuroscientific measurement methods like MRI, we can distinguish between non-transgender female and male brains, especially if we look at populations and not individuals. If we have a MRI, for example, from a group of non-transgender women and men, and look at the volume of brain structures, we can see that two groups are formed. For example, non-transgender women have stronger pathways between brain hemispheres and have denser gray matter, while non-transgender men have larger brains in general and more white matter within the hemispheres. Using these measurement techniques, we can ask interesting questions about trans brains. For example, do trans people have brains that are more similar to the brains of the biological sex that they want to transition to? Let's take a look at the data. The neuroscientific evidence seems to suggest that rather than two strict brain types, there may be an in-between state or another brain type. In particular, for people who want to do male to female transition. That said, despite this diversity, trans people have brains that are more similar to their sex assigned at birth. The important question, however, is whether the brain areas that are associated with identity are different or not. The science on that is not clear, and we will have to be patient and make do with what evidence we have today. Most studies struggle with having low sample size and other science labs not being able to confirm their findings. The largest study so far looking at gender diversity and brain is one with 2,165 adolescents aged 13 to 15 years old from the Netherlands general population. In this study, no significant difference in total brain volumes measured were observed between youths who reported gender diversity and youths who did not. However, these findings further suggest gender diversity in the general population correlates with specific brain morphologic features in a brain area called inferior temporal gyrus, and that's among youths who are assigned male at birth. Interestingly, the inferior temporal gyrus is involved in recognizing faces, including one's own face, and linking visual information to identity. It also contributes to processing visual representations of the body, especially in relation to appearance and social meaning. In gender-diverse youth experiencing gender dysphoria, discomfort with the body could influence how visual self-representations is processed, potentially altering activity or structure in regions like the inferior temporal gyrus. Finally, inferior temporal gyrus helps interpret social and emotional meaning of visual stimuli, such as gendered expressions or roles. Youths exploring or asserting transgender or non-binary identity often engage in deeply with gendered social cues, potentially leading to neuroplastic adaptation in regions like inferior temporal gyrus. To summarize, the evidence supports the notion that the underlying brain anatomy in transgender people is shifted away from their biological sex towards their gender identity, or at least to something in between. This suggests that gender identity is, at least in part, biologically ingrained, not something chosen or learned. A thing we also know is that transgender people have higher risk of having mental illness. To be clear, being transgender is not a mental illness and does not cause a mental illness. This has been clearly stated by the World Health Organization as the scientific consensus. However, trans people are more likely to experience discrimination, rejection, and other social stressors, which increase the risk of depression, anxiety, and suicidality. The instinctive response from most people given this information should be, how can we help these people feel better? How can we remove these stressors? Some still claim that being transgender is something that can or should be changed. This idea fuels what is known as conversion therapy. Conversion therapy includes practices aimed at changing someone's sexual orientation or gender identity. These range from counseling sessions to religious interventions, and sometimes even physical or psychological abuse. Here's what the research says. It doesn't work, and it causes serious harm. A major 2009 review by the American Psychological Association found no evidence that conversion therapy is effective, and plenty of evidence that it increased depression, anxiety, and suicidal thoughts. Survivors often describe it as traumatic, and some say it left lasting emotional scars and made them feel broken, ashamed of who they are. And now here's the question that matters the most. Does gender-affirming therapy help people? The answer, according to dozens of studies, is yes. Puberty blockers, for example, are used to pause physical development in transgender adolescents, giving them time to explore their identity. Studies show these treatments reduce gender dysphoria and dramatically lower rates of depression and suicidality. One 2022 study found that youth who received puberty blockers and hormone therapy were 60% less likely to suffer from severe depression and 73% less likely to consider suicide. The main problem with puberty blockers is that it is well known that the neuropsychological impacts of puberty blockers are complex and often sex-specific, and there is no evidence that cognitive effects are fully reversible following discontinuation of treatment. A meta-review from 2024, analyzing many previous studies, showed that there is some evidence of detrimental impact of pubertal suppression on IQ in children. They conclude that critical questions remain unanswered regarding the nature, extent, and permanence of any arrested development of cognitive function associated with puberty blockers. For transgender adults, gender-affirming hormone therapy has been linked to improved mental health, emotional stability, and quality of life. And out of 55 peer-reviewed studies reviewed by Cornell University, 93% reported positive outcomes for those who transitioned. Hormone therapy also have some downsides, but since it is mainly for adult people, generally people think this is less controversial compared to puberty blockers. With that said, even if people don't think that puberty blockers is the way to go, there is a lot that people can do just by changing their behavior. For example, don't discriminate against trans people, like in the case of interviewing people for jobs. Or if you have a trans person in your family, then accept and respect them. Don't be afraid of trans people. Try talking to a trans person or even become friends with one. You will likely find that they are as nice as or even nicer than most people. At least that's my experience. If you work in healthcare or the legal system, then try to be accommodating and respectful. Since trans people are a minority, you might be caught off guard. Challenge transphobia and misinformation. Speak up when you hear transphobic jokes or myths. Correct misinformation calmly with facts. Avoid assumptions about someone's gender based on appearance. And be mindful about curiosity-driven questions about individual trans people. Don't ask invasive questions about someone's body, medical status, or past unless they invite conversation. Focus on the person's experience and comfort, not your own curiosity. You can also try to listen without trying to fix or debate. A lot of trans people face constant scrutiny, so let them share their experience without treating it like a debate topic. Finally, you can educate yourself And if you watched this video this far, then you have at least partially done a good job. So nice job. One thing you can learn about are gender identities, terminology related to trans people and gender identity, and the challenges that trans people face. The evidence is quite clear. Transgender identity has biological roots. Conversion therapy is ineffective and harmful. Gender-affirming care works, it saves lives, and as many other medical treatments, it has complex side effects and potentially permanent changes which need to be considered. Science isn't about ideology, it's about evidence. Transgender people deserve support, dignity, and access to healthcare grounded in compassion and science. Thank you for watching. Don't forget to like the video and subscribe to the channel. Goodbye.